Hey there, Michelle. Really good post. I think giving diagnosis can also be a very useful tool for knowing kind of which direction that we need to go with the client, um, and having that kind of in our pocket, for a lack of better words, um, can kind of give us a good indication and guide of what direction we do need to go with, and it could provide clarity to the client as well, um, depending on what they are kind of working through. Um, Being stigmatized is an issue. Um, I think informing the client about said problem they may be facing is a good way to kind of work them through it early on, just so they don't feel kind of like stigmatized um, outside of the counseling session. Because within the therapeutic relationship, I think it's really important that we come off as level grounded, I guess would be the word I would use. Um, and just making sure that that relationship is secure and stable for them so they can kind of grow, um, and there is a treatment plan that's effective and efficient for them, and we want to give them the best possible care. um, I do have my concerns with giving diagnosis, and I think overall there is positive and negatives that can come with giving a diagnosis. um, I think we kind of have to look at it with a perspective of, okay, would this harm my client, would this help my client? We have to consider the healthcare insurance implications as well, which will lead to conflict with most likely all of us in the future with counseling, um, just because that's kind of the box that's set up for us. Um, and it does kind of, I feel like it will hinder us at times in the future when we're trying to give the client the best possible treatment possible. Um, but overall, I think with just like diligent assessment, diligent care, and just communicating properly between the client, the counselor, even the healthcare provider, um, we can really minimize the risk of negative outcomes if a diagnosis is given, and providing the client with the best care possible, um, and giving an accurate diagnosis and trying to make sure that the client does get their reimbursement for their care.